Okay, we are recording.
Great, thank you, Karen. Good afternoon, everybody. My name is Numili Griffiths. I'm a senior policy advisor with the Division of Financial Regulation at Oregon's Department of Consumer and Business Services. This is our fourth Rulemaking Advisory Committee meeting for rules related to the implementation of 2021 Senate Bill 763 relating to the licensure of pharmaceutical sales representatives. I'm not going to go through the rigmarole of calling roll. I'll just note the formal RAC members who are present. We have Anne Murray, representing pharmaceutical company Bristol Myers Squibb. We have Daria McGrew, representing Pharma. Brian Van Hoy, representing G&M Health, which is a continuing education provider. Chloe Becker for the Oregon Coalition for Affordable Prescriptions, which was the primary proponent for the original bill. Maribeth Garino from Osberg, which is a consumer advocacy organization. Mark Bonaro from the Oregon Medical Association, representing providers, and Rick Blackwell from Pacific Source, representing insurance, and also a supporter of the original bill. So wanted to kind of go over our game plan for today just quickly. I did send around two drafts of the permanent rules. So one of which has changes marked in track changes. The other one of which is a clean draft, kind of breaking this down into three sections based on from what I think is the most controversial or perhaps most extensive changes. First, which is the monetary value issue. Then these fairly extensive changes that were mostly proposed by our program staff, and we do have Christina Boone from the program team on to discuss as needed, as I'm less familiar with all the changes in there, but I think that because they are making the rules less complex, they should be fairly non-controversial. And then there's a variety of other sort of minor little housekeeping changes that I've made. I don't promise that this draft is typo-free, and if you do see anything that looks like a typo, I do appreciate you pointing that out so we can get that fixed before we post to the Oregon Bulletin. So without further ado, I'd like to jump right in, and let me pull up my draft here. And I will share my screen so that we can all be looking at more or less the same thing. So the first issue that I wanted to address is related to the question of monetary value and kind of what we're, I'll give it a second to see. Catch up here. And just as always, please try and remember normal teleconference etiquette. Keep yourself muted when you're not speaking. If you are speaking out of turn, myself or Karen will mute you. We are trying to minimize feedback. We will have a period of time at the end of the meeting for public comment. So if you are not a designated RAC member, please reserve your thoughts and questions until that point in time. And yeah, so I will go ahead and get into this. So the issue that I wanted to address first, oh, right, and also I cannot see the raise hand function while I am sharing my screen. So if you have thoughts, just please pipe up for our RAC members, and we will be open to discuss. So the sort of first thing that I wanted to bring up was related to the changes in terms of reporting. And so this is draft rule, let's see, 620, 836-200-620, which is the reporting requirements. There's two changes that I've made in here. Well, there's one change that I've made, one of which is changing of each year to of 2020 2023 and each year thereafter. We're not sure when we'll get things filed, and I don't expect to get this in before the April 1st date, but I did want to make sure that the language is clear that we are not expecting reports from our licensees for 2022. The other thing that is perhaps more controversial is what I haven't changed, which is leaving the monetary value as reference to samples. I did provide a written explanation of our thoughts around this issue, but I'm going to go through it quickly as well. So just the sort of background on this, this language comes from the statute. We received some feedback from RAC members in previous discussions of the permanent rules that assigning a monetary value to product samples for prescription drugs is prohibited in some way by the Affordable Care Act or Prescription Drug Sample Reporting Program under ACA Section 6004. And we had discussed potentially swapping out monetary value with respect to the product sample aspect of this, as well, without touching the sort of materials or gifts aspect of this, and using instead quantity or volume. So I had discussed making that change, but we wanted to make sure we were okay with that. We checked in with DOJ and ultimately concluded in consultation with DOJ that not including monetary value of samples as part of the report would be in conflict with the literal language of our statute, which does require reporting of that information. So out of concern, we don't want to violate federal law. We did do some research into ACA Section 6004 and the associated regulations, and concluded that it was not that, well, that section relates to reporting on prescription drug samples to the federal government. And basically the way that that works there, the argument was that because monetary value is not one of the elements that is reported for drug samples, that would in some way bar a different entity from assigning a value to a sample or requiring reporting of that. We don't agree with that interpretation of the regulations, and basically, so we are going to be collecting that, expecting that information as part of the reports as it comes, in an effort to try and make sure that we're clear what we mean by monetary value, and in recognition of the fact that samples are samples, they're given to providers for free, and so may not have a monetary value assigned. It's I've added an additional definition, which is listed as subsection 9 to draft rule 836-200-605, which is basically just defining monetary value for the purposes of describing the value of the drug sample. And so that is this draft text here, which basically reads, for the purposes of describing value of drug samples for this purpose, monetary value means the monetary value of an equivalent volume or quantity of the prescription drug estimated using the WAC price for the most comparable NDC, with the thought being, okay, you know, obviously there's going to be bulk discounts for larger quantities of a drug, so it's just try and get as close as you can using the most similar NDC that is actually marketable. Since I came up with this language last week, I don't promise that it's perfect. I just want to make sure that it's clear what we're looking for and that the intent is interpreted. So one of the things that I have asked the group for is feedback on this language specifically, whether that is sufficiently clear. So I'm going to stop. And I recognize, because we have had comments about this before, there may be pushback on not making the change, but at this point, our position is that we are going to be collecting this information. It would be in conflict with the state law to not do so. So any comments, concerns, or feedback on either leaving monetary value for drug samples in or for the proposed definition language?
Hey, Numi, Daria at Pharma here. I can understand DOJ saying, but that's in the statute. We do have concerns with conflict with federal law, and of course need some time to investigate that. You know, can't comment specifically on on this language today. We will be filing a letter there. I was wondering if DOJ wrote any sort of formal opinion for you on this ruling that we could reference.
We do not have a formal letter ruling on this. This was purely based on internal discussions at this point. But if you are, if you do send in a written comment, I'm sure we can be more. It may become necessary to pursue more formal guidance, shall I say? So,
Great. Okay. Yeah.
There is not a formal guidance that we have at this time, but that if the issue is pushed further, it's like I may choose to procure some before we speak.
Thank you.
Numi, this is Mary Beth Garino with OSPERG. I really appreciate the fact that you went to DOJ and got this explanation and analysis from them. I apologize for the background noise. I'm by a highway. And I really appreciate the definition in being like trying to be as consistent as possible with federal law and taking the fact that the statute says monetary value and putting the definition in. So I really appreciate this definition and the work that went into it. So thank you.
Numi?
Go ahead.
This is Brian. Yeah, just real quick, and I appreciate you taking the effort too. And I think I'm still, at least from my perspective, and just being around these regulations for many, many years, and knowing what the government's intents were on some of the other regulations, concerned that putting a value, and I think if you look at the ACA, not just ACA, you also got to look at PDMA, 21 CFR Part 203. You also need to look at the OIG guidance to pharmaceutical companies, which is very explicit in that you need to tell doctors that this stuff's free, okay, that these are free, there's no value. And even the PDMA labeling and everything's free, no value. Is the sampling data also a public information? So would this report be public?
Our expectation is that it would not be public, and since we don't have any sort of public reporting requirements or any sort of study obligations under 763, I don't see any circumstance that anything would be published outside of basically a public records request situation, and that I would consider this something that would likely receive analysis as a possible trade secret if we were going to have such a request come in.
Yeah, because I do recall under ACA, there was a lot of concern about making sample data public. And this is coming a lot from HCPs, and it's the same logic would apply to having it public for sales representatives and offices. That may not be specifically when DOJ looked at that, but I know that was definitely discussed as part of, and that's why it's not public for the federal report. And there's no value assigned to it as well. So it's contrary, the whole thing with value in terms of what drug companies are told by government agencies about samples because of kickback concerns and all kinds of things, drug diversion, theft. We are very much trained and very, very much endowed on there is no value. We do not put a value or assign a value to a drug sample.
I do appreciate the concern, and so certainly, like, my original intent was to adjust the language to try and avoid this problem. We do appreciate the concern. If we do get additional written comments on this that kind of rise to the level or pointing to specific places in federal law or federal guidance that look like we really would be in conflict with federal law to do this, please send comments. It simply in my discussions with DOJ, they did not find the arguments that had been presented in written comments previously from various parties to be persuasive as to barring us for that reason. So I look forward to seeing additional arguments presented on this if there is the belief that this interpretation of this implementation of Oregon law would be inconsistent with federal law, I mean, please point directly, please provide citations, and we will do what we can. And if we are continuing to pursue the path of requesting this information, we will, I will approach DOJ about getting a formal opinion, so that we want to cover our bases too. So do appreciate the concern. I know we have Christina on the line. Do you have any, does anybody from the program team, either Christina or Haven, have thoughts maybe on the sort of concern about publication of information, or how we would approach that if there was a public records request that came in related to the sort of sensitive information?
This is Haven. I don't really have any initial thoughts. The way that we usually use these annual reports is more of a cumulative, providing data, not specific information. So I imagine that would be the same here. If it was a public records request, then we could, do our best to mark that as being confidential and just redact that out of the spreadsheet, because there's a lot of information we would be redacting out of the spreadsheet if it was a public records request. So we could just do that if that situation arises.
Thanks, Haven. Any other thoughts, questions, concerns about the monetary value for drug samples issue?
This is Chloe with OCAP. I just want to echo Mary Beth's comments and just thank you, Numi, for your work on all of this and the due diligence there. I think the definition you provided looks good at kind of first glance, but definitely we'll be running it through all of our channels and look forward to responding in writing if there are any other comments. So thank you for everything you're doing on this.
Thanks, Chloe. All right. Well, if there is nothing additional on that, I will look forward to seeing any written feedback, both on the proposed definition as well as the federal law issue, so I can take that back to DOJ. And I will go ahead and move on to the other changes. So the next, and I am actually somehow way ahead of schedule, so maybe we can actually wrap early today. We will see. So the other sort of big changes that were made were to the, and let me switch to my clean copy. That is more readable. So the other sort of major set of changes is significant changes made to the education requirements. And so just kind of generally speaking, oh dear. Oh, there's a typo already, great. Anyway, so I had attempted to renumber these, but apparently that did not go through all the way. So education requirements, so sort of from 836, 200, 640, and so on. We've basically replaced the text of the rules, since the draft that I got came from program team, and I've kind of just replaced it so it's not as readable as we might like it to be in the red line in order to kind of see what's going on. But sort of the general idea for the changes that we made here has been to simplify the rules, not to add additional requirements or anything like that. Most of these changes have been to the effect of removing language. So most of this language, as I've discussed previously, was adapted from our existing rules for licensure of insurance producers, where there's a lot of additional regulation and issues that we're dealing with, such as reciprocity with continuing education in other states. So we are looking to basically remove redundant language that is unnecessary. So those references to reciprocity programs and other sort of things that make the registration of courses, registration of education providers, et cetera, more complicated than they need to be. So I don't know, Haven or Christina, if you have anything else you can say specifically about the sort of broad changes that we've made to the continuing education rules?
Sure, this is Haven, and we just really wanted to streamline it. We have the options of how people can apply on if it's not an approved course with Oregon. We've already had some, Tina has reached out to some educators who are requesting that they be approved here, and so we're working with them and actively trying to get that off the ground. One of the things we did is took out any reference to pre-education or pre-licensing education, continuing education, because this license type doesn't require like an exam or a certain very specific classes for the pre-licensing education. We're just making it more broad that you just have to have 5 or the 10 before and then 5 continuing, but it doesn't mean that those same classes wouldn't be available, both pre-licensure and continuing licensing.
Can I clarify something real quick or make sure I'm understanding? This is, you still want proof that the CE was completed, right? So this is each person will have to submit that they've completed it.
No, the way the SBS and NIPR work is that the education provider registers with that program. Tina always laughs because I always get this mixed up, but I think it's NIPR. They register with their classes, and then they actually provide us with the data of who has taken what course, and it is all automated. If for some reason there is a the fail-safe is that the licensee should keep copies of their certificates or emails showing that they completed it in case there's a problem with the system. But once we get the providers up in the program running, then that will all be kind of automated where they can upload the information and we can verify it without the licensee needing to do anything. The only time they
Yeah, I'll propose something that might make it easier for you. I don't know if you'd want to consider it, because it sounds like then you're going to have to look at all the providers, add up all the CE for each individual licensee to confirm that they did it, right?
We already do that with insurance.
Okay, so it's already automated in your system.
Yes. Mm-hmm.
Okay. Yeah, because a parallel I was thinking is, I know I just did mine for my pharmacy license. I just had to finish it for last year. We never actually submit it. It's all documented. You have to verify, certify that you've got it, and then they randomly audit the healthcare professionals. You don't submit them.
Yeah, this is already set up because we have done it for insurance producers for years, and it works really well to get everyone on board. The only time that the licensee would have to submit something is if it's not an approved Oregon course, then we can look at those individually and see if they meet our criteria.
Thank you.
Mm-hmm.
Yeah, so what I'll note with respect to that sort of question is I think the general expectation is going to be that in most cases, the individual who's submitting for re-licensure isn't going to need to do anything in terms of providing credits, since those will be reported to us directly by the education providers already. The sort of general exception to that would be, of course, we have 836-200-670, which allows for credit for unregistered courses, which is what I can foresee as being the main circumstance in which we would not have, since the course is not registered, we would not receive the documentation for that through state-based systems. And therefore, that would be the sort of situation where you would expect we would expect a licensee then to have to submit documentation, would be when they're using an unregistered course or trying to use a different course for proof of their continuing education requirement. So I had made another change that I wanted to mention later, which is kind of related to that, is that I had added a clause to the application renewal, which is, where are you? Oh, I put it in one clause, but not, oh, there it is. So documentation shows the applicant has completed at least 5 hours continuing education if such documentation has not already been submitted by providers. And so the expectation is that education providers will normally submit it. I will go back through here and remove these additional references to continuing in my sections of the draft, since it looks like I missed that one. But that's the sort of general intent of that change, as well as it is to clarify that in most situations, the applicant for license renewal will not need to actually submit applications already been submitted.
Naomi, this is Ann with Bristol. Is that information something that the sales representative can go online and look up? How would they know that?
Haven, do you have any insight into that?
On the continuing, people being approved for the continuing education providers?
No, this clause that Naomi has added that says that the applicant has to submit the 5 hours of CE certification or proof if that documentation has not already been submitted by education providers. How would they know whether it's been submitted or not?
When they apply for renewal, we will be able to see their CE credits that were uploaded. And if there's anything missing, we would reach out to them and say that we don't have everything. But if they're using an approved provider, then it should be uploaded. So the cases where we would need the proof is with the unregistered or unapproved class that we would have to have.
Right. My question is, can they go online and see what you're seeing?
They are able to go online and see how many credits that they have submitted, someone has submitted on their behalf, yes. So once they take a class, a provider uploads it. It takes a couple days to turn around. The provider uploads it, and then the individual licensee can go in and confirm that that information has been uploaded.
Haven, this is Tina Boone. I want to add in addition to that, the way that we're working the system to be set up is that it should automatically upload those credits, and when the PSI would go and renew, if those credits aren't automatically uploaded or sent to me to have them manually uploaded, it won't even allow them to renew. It will stop and say that there's no state available to renew. So those, either by them submitting that form of unregistered course or having the providers automatically upload, it will have to be there before they submit the renewal.
How are all the providers going to know that they have to do this? And I think you said like on a daily basis, or how frequent? And how are they going to upload it?
This is Tina again. I am currently working with them, setting up a process, and very similar to how we helped the pharmaceutical get going on applying. They'll have step-by-step on how to do this, and I'm available for any questions along the way. So everything is very outlined on how they upload, how they register, how they submit the credits once it's completed. So that will be laid out to them.
And how often they do it will be up to them. They can, after every class or once a month. I don't believe this statute requires a particular time, but we'll have instructions for them to do all that.
And those approved providers, or those providers that have already hooked up with your system, are going to be on the website for access for folks to know where to go and what courses to take, or what courses are available to take?
On our website will
Yes,
be, oh, go ahead, Tina.
Sorry. Yes, as soon as we have everything in place and set up, there'll be two ways that, so the PSR will be able to go on and actually look up, because they're going to be assigned a national producer number by registering with us. So they can go on to this website, which is the external state-based systems website, and view the credits they have, the credits they've earned, all that information is kept when the provider uploads with us. And then also keep track of where you're at and how many credits you need. In addition to that, the provider also can go in and track who they've submitted and those kind of things.
But the sales representative can find a provider on your website is what I'm saying, what I'm asking.
Yes, they'll be able to find the detailed courses. So
Okay.
what the course is, how many credits is going to be available, and how to register for it.
Thank you.
Any other questions, thoughts, concerns related to continuing education rules?
I admit, Nomi, I haven't even read them. I opened it when the call started at 2 o'clock. So like others who have already commented, I reserve the right to send you a letter.
I would expect no less from you. All right. Well, with that, of course, we can always come back if any thoughts occur, but I'll go on to the sort of other changes, which let me back to my interlineated copy. So already discussed the proposed definition for monetary value. I've changed well both are to just located here. And this is because we have been generally issuing guidance that we're expecting people to license if interacting with healthcare providers as a sales rep. I you know, maybe being excessively legalistic, had already thought that, well, both are, you can be digitally located in a place in some sense, but I just wanted to clarify that we do generally expect people to be, we would consider people to be doing business as a pharmaceutical sales representative in Oregon if they are promoting or marketing a pharmaceutical to a healthcare provider in Oregon. So this would extend to sort of remote transactions as well. So that is one change. That was pointed out by the program team that potentially could be interpreted as being more narrow than what we had been telling people. So I've got that proposed change in there. Any thoughts on that? Questions, concerns?
Yeah, I mean, the thing that comes to my mind is, I know Chicago, other places have always excluded that. And I think possibly the reason for it is oftentimes there's teledetailing or whether it's a website or it's through the phone. But a lot of times those companies, that's not actually a drug company, but it's somebody, a marketing firm that a drug company may be supporting. Those individuals may be representing more than one company. So therefore, do they have to have multiple licenses when they're calling on the same doctor, but they have different products? It's going to get real confusing. And I think that's probably some of the reasons why it was excluded, you know, and they said both parties had to be physically present in the state to make sense of this, you know, I mean, versus allowing, you know, somebody that's calling from the East, you know, calling from Florida to Oregon.
No, I don't think that, my interpretation, I think just from sort of plain meaning, since we're applying sort of the license on the level of the individual who is acting in business as a pharmaceutical sales representative, rather than looking at it on a drug by drug basis, that, you know, you could represent 50 companies or you could represent one company. We're still only expecting one license for that particular person. Obviously, that does potentially complicate the way that the reporting is going to work for them, is that they'll have multiple compliance reports once we start getting the annual data reporting coming in, that they will have multiple people submitting information on their behalf. So that's out there as a thing. But I don't think that should be an issue, but the guidance that we had been giving people so far is that rather than expecting everybody to be located physically within the state of Oregon, that we were thinking about it more in terms of marketing prescription drugs to people, to healthcare providers located in the state of Oregon. So, and I don't think that contradicts the language of the statute. This was a section where the original language had been pulled directly from Chicago. And maybe also this is complicated somewhat by the times that we live in, that everything is remote, that it doesn't seem consistent with the intent of a licensing bill passed during the pandemic that we would be excluding people who are performing this function completely remotely for healthcare providers in Oregon, but certainly open to feedback on that proposal. Any other thoughts on the location issue? Okay. Let's see. Other changes. I already discussed this, the documentation issue. Already discussed this, the 2023 and each year thereafter for reports. We don't expect reports this year, and we want to make that clear. And let's see. So made a couple of changes to 635. Again, we'll be removing the continuing as well as the pre-licensure language there. Made a couple of changes. So this is a section that was originally adapted from Chicago. Their sort of initial course of education includes this sort of section B, ethical standards and disclosure requirements required of licensees, as well as an introduction to the pharmaceutical representative license, where that course is actually provided directly by the city of Chicago, is my understanding. I've proposed basically removing these two things because we're not planning on offering a course ourselves on such things. And I do recognize that there is a typo that I have not successfully renumbered these subsections down here. So I will get that in there this afternoon and send a cleaner draft to you all. And I've also added this clause here that the initial course of education can also include any of the topics that are connected to the sort of license renewal education requirement, subsection 2A here. So that's the whole list down here, things that could be included. Doesn't have to include all of them, obviously. This is just potential stuff that would be accepted. So that is another change. And as I've already said, like I am removing the continuing as well as renumbering this a little bit more cleanly than I managed to the first time around. Any thoughts or questions, concerns about those changes?
I don't have any on those, but can I go back real quick on the person not, that may be making calls into Oregon? Is that in effect now, or would that be after final rules? They still have the 14 days, right? They would have to.
Yeah. So
you have to make one call,
I mean,
I guess, a day.
It's like you're calling to Oregon for 15 days, then that would apply, I think is the interpretation. Hazen, do you know what sort of guidance we've been giving to?
Because it's normally the real ones. It's right. You're in there for a day, that many days. On the phone, you may call and have a 5-minute conversation. That's a day?
Yeah, no, I mean, that would generally be my sort of interpretation, is like you call Oregon 15 days in a row, even if it's only one call a day, that still constitutes doing business in the state of Oregon, and that would be consistent with other legal definitions for sort of location purposes and jurisdiction purposes. But my understanding had been that our guidance had been that this does apply to people who are operating purely remotely, and that's what we had been telling people for the sort of first year licensure. Is that inconsistent with what we've been doing, Haven or Tina, or is that more or less what we've been doing so far?
So yeah, the way I've interpreted the 15 days is that, yeah, if you make a phone call once to Oregon, it kind of eliminates that day, right? So what I've been telling people is set up all your calls for Oregon for one day, and then that way you're maximizing. There's no adding like, oh, this call only took 5 minutes. I can have 100 of these calls before I get to 15 days. If you make a call to Oregon, that counts as your first day, your day one. And then if you call 3 months later and you have a call to Oregon, that's day two. And then that's basically the guidance that we've been giving people, and that any contact with an Oregon physician while the physician or the healthcare provider is in Oregon counts as a interaction that needs to be recorded and counts towards that licensure. Does that answer the question?
That helps. Thank you.
Thanks, Avon. That was consistent with how I was thinking about this as well. All right, and I believe that is all of the changes in the current draft. So would anybody like to go back to anything additionally? Other questions, concerns while we have the group assembled?
Is the word gift defined anywhere?
We do not have the word gift defined. Do you think there's some degree of ambiguity around that?
I do. I mean, it's very open. What's a gift? How do you define it? Is there a minimum threshold? Because to me, this law is not only a sales rep licensure law, it's a disclosure law. This is not, unlike Chicago, which disclosure is only upon request for C2 promotions only, very limited. This is all drugs, prescription drugs, and gifts. How do you define it? I think companies are going to need to know that to fill out your report.
I will take note of that, and I am open to suggestions. If anybody has any thoughts on how gift should be defined, I'll look into that and we'll circulate draft text before. It does look like so I had mentioned in my email earlier that Karen distributed around to the group that I am expecting to have one more RAC meeting in March, and that's probably going to be stretching the limits of my timeline to get something to Secretary of State for sort of the final NPRM. So we can look at some additional changes, and I'm hoping to have the other stuff that I've mentioned, polishing, done by then as well. So I will take note of that. If you have suggestions as to how gift would be best defined from any of the stakeholders, I would appreciate that. If nothing comes in, I will take a stab at drafting something myself. Your discussion. So,
Numi?
A comment
yes.
on that. Oh,
Yeah, go ahead.
Go ahead.
a comment on that, Numi, because we talked about it initially on one of the first or second calls, and I think you were going to talk to DOJ, and correct me if I'm wrong. I don't think we got clarification yet, but back to the ACA. The Sunshine Act has a very specific preemption of state laws with regard to reporting certain requirements because they're already reported under the Sunshine Act under federal law, where providers actually have an opportunity to go in and review and object, if you will, or clarify before it's all published. So to the extent that the information in 763 is already reportable under the Federal Sunshine Act, thereby specifically preempted from states requiring reporting. We talked about initially the preemption. We talked about preemption at a very initial RAC meeting, but I don't recall what DOJ said with regard to that. And it doesn't seem, the rules still don't seem to have any reference to that preemption under federal law. So that which is reported under the Sunshine Act states are prohibited from then requiring reporting
It's
of
the
it
same
under
information.
state law. That makes sense?
Yeah, that makes sense to me. I will
And
look
gifts,
into that.
gifts are included in that. So that's why I was
Right.
saying that maybe that's a solution.
Right.
Yes. Well, I appreciate you addressing that. And if we do have comments related to the other issue with DOJ, the monetary value issue, you can point me to the specific citations for the Sunshine Act and any associated regulations. I would really appreciate that, and that's something I can take back to DOJ and
Okay.
hopefully get sorted out before March. So do appreciate that.
Okay,
Thanks.
we'll
Ed.
do that. And there are exceptions or there are certain exceptions, but I don't see that any of them actually apply in this instance, but I'll send you the reference.
Appreciate it.
I have two other questions, if I may, unless somebody
Go
else
for
has a point about what we're talking about right now. I understand that we're reporting individual sales representative interactions with individual providers, but to the extent that they occur on the same day, same representative, same provider, our assumption is that we can report that in the aggregate for that day.
Yes, that is correct.
Okay. Okay. And then also, just to clarify, I know we've talked about it before, but companies can report on behalf of their field sales representatives. in
That's
terms of-
correct.
Yes.
And the
There's a
system will, go ahead.
there's a spreadsheet now that's on our website that can be downloaded, and that information will talk directly with the database that we're building. So we request that you use that spreadsheet. If you use anything else, you have to make sure it has the same data points. But yes, you will be able to, the first two lines, two columns are like license number for the producer or for the
Right.
licensee. And so you'll be able to provide information for multiple sales reps at the same time.
Right, and I saw that on the spreadsheet. I wasn't certain that it was clear that multiple can be submitted by one entity.
Yes. Mm-hmm.
And I think the last thing from our perspective, at least initially, I'm not having read this in full yet, would be the duration piece is really a challenge in the sense, and I know we've talked about this before, but I'll bring it up again because we only have one other opportunity to implore you to reconsider that. And I saw the different buckets of time in the drop down, so I certainly appreciate your effort or your willingness to clarify that. Our systems don't capture that, and so as we talked about before, it's going to be a guesstimation. And so to the extent that we could broaden the buckets of time, if you'd consider broadening the time periods that are in there, I think that it would be, I won't say easier, but more likely accurate if in fact the time windows were much broader than they are right now. Does that make sense?
Yeah, so what would you have in mind? I'm looking. So less than 15 minutes. So go ahead.
Go ahead.
So the categories for those who haven't seen it, less than 15 minutes, 15 to 30, 30 to 2 hours, 2 hours to 8, 8 to 24. So what would you suggest?
How about anything over 24 hours? That was a joke. Laugh. Okay, that's funny. I'm being funny. Okay. Let me ask you this question first. If a sales representative goes to the office and sees no one but leaves information, does not see a healthcare provider, that's not reportable, correct? So that duration may be a minute, but they have not promoted and marketed to a specific provider. So I guess what I'm saying is that, you know, in the 15-minute hit, when somebody goes in for 5 minutes, may not see an HCP at all. May, even the front person at the front office. Just trying to make sure that we kind of cover our bases in terms of what the expectation is. And
the language in the reporting of contacts is contacted, not necessarily marketed or promoted. And, you know, my sort of initial reaction is that dropping off literature counts as marketing, even if it doesn't follow the conversation with the HCP. So yeah, I like certainly I think that talking
it's marketed or promoted. Marketed or promoted.
Marketed or promoted is the definition for the purposes of who is applied, who the law applies to. The requirement for the requirement for the reporting is contacted, not specifically marketed or reported or promoted.
I think the point is.
So if a sales rep sees somebody at a Starbucks,
no,
you expect that to be reported?
Haven, did you have something you were gonna say? I saw your square light up for a second.
Yeah, on the instruction page, it's for the spreadsheet. It specifically says that, you know, any interaction where you attempt to communicate with an HCP, as well as anytime you leave materials or samples for that HCP, even if you don't communicate personally. So if you go in there and you like have an appointment and find out that the HCP is gone, but you leave materials, I interpret the statute as requiring that as an interaction that is recorded. And that would fall under the less than 15-minute category. So I'm not sure if you want to broaden them so they to not pick that up. I'm a little confused on your
No, not necessarily. I guess we're just trying to figure out exactly how we report most compliantly when the system currently doesn't catch that information. So let me noodle this a little bit more and we can add something to the comment letter, but I'm just interested in making sure that those time buckets aren't so tight that if we get one wrong, then we're subject to what, $10,000 a day in fines or something for not having answered it properly. And I know we can cover some of this in the cover letters too when we actually send you guys reports, but to the extent that you're asking us to certify the information, I want to give us the best opportunity to accurately answer when, again, systems don't catch that information, current systems. So, and I know you guys you're sensitive to trying to work with your current system to make it work for your purposes in terms of the insurance, the producers, as we are with our reporting systems right now. So.
Was there anything else, Anne? Or is that all of the concerns you had at this point?
That's all for me for now.
Okay.
But yeah, I guess, are you amenable like to an assumption document? Because like there is no way to do it systematically. You know, you're going to have some kind of an assumption document, and that's the best guess we have. And here's what it is. And most likely 90+%, 99% are going to be less than 15 minutes.
Yeah, no, and estimate is the expectation for the sort of duration reporting. It's yeah. So yeah, we would be amenable to that sort of reporting, and I mean, it is going to be imperfect, but it is what we have been directed to do. So we are collecting that information. Any thoughts, questions, concerns from other RAC members? All right. And I forgot to let our members of the public know that they could contact Karen in the chat if they were interested in giving public comment. But so I will give a few seconds for that. If we have any members of the public who are interested in giving comment, and message Karen in the chat.
Hi, Numi, can you hear me?
Yep.
Okay, this is Michelle from Santa Fe. I have a couple of questions for you.
Yeah,
The
go
first
for it.
one has to do with reporting timeline. Now, when in the previous meetings, you mentioned that there would be ad hoc requests for reporting during the year to reps. Is that still going to happen, or is this just moving towards a more annual reporting? Because it does matter as far as how we set up our reporting structure.
Haven, I know we wanted to do some testing with hopefully having some sales reps who we actually have a good relationship with, but I'll let you address that.
Yes, that we do envision that there may be times that we would have to do an ad hoc. I can't tell you when that would be unless the legislator came and asked for the question that we haven't collected yet. I don't imagine that that would be used often. We are going to look for some volunteers to help us test the system once we have the back end of the spreadsheet built. So that would be an ad hoc request. I don't want to say exclusively it would be a yearly mandatory requirement. So I can't guarantee that that would be the case, but we envision it being once a year with the, some exceptions that may arise. I know that's not a good answer, a helpful answer. That's my legal answer.
Okay, so thank you for that. My second question is related to some definitions. So if you're going to be adding a definition for what a gift is, can you also consider adding a definition for what you mean by other compensation, like what you envision that to encompass? Because that's not clear.
That's, yeah, the dreaded catch-all provision. I mean, I'd certainly be open to suggestions if, as it would be interested in suggestions on gift, would be interested on suggestions on other compensation, particularly from the bill proponents. So just putting that out there, and we'll consider that and try and get a draft back to you significantly earlier so that we can have a round of feedback before the next live meeting.
That would be really helpful. And because the other thing that popped up is in the instructions where it talks about what is an interaction on the spreadsheet on that tab. And it's the last sentence. It says, if you pay for the HCP to travel outside of Oregon for a meeting with a licensed pharma rep, the interaction must be reported even though it takes place outside of Oregon. The question I have for you here is the expectation that a rep is actually going to pay for someone to travel? Because most pharma companies I know of, the rep does not make the payments to HCPs to do any travel. That doesn't happen ever. It's paid for by the company, right?
So that is something that's come up in the guidance from Haven. Do you have something?
No, go ahead, Nui.
Just wanted to clarify, Michelle, is that something that is coming from, not from the draft rules, but from the guidance that the program team has put out?
Okay, understood.
Oh.
Okay, so what you're saying is that the company would pay for the Oregon HCP looking at
The
it.
scenario provided isn't realistic.
Mhm.
Yeah, and it's not even realistic in the fact that I don't believe any drug company would pay for transportation in order to travel outside of Oregon in order to promote or sell that person. Where that's being done, it's generally under a service agreement where that provider is providing input on a clinical trial, or there's a service that they're providing you and you're reimbursing them the expense of providing advice or whatever. It's not promoting and selling. So it seems like that
Thank
whole
you, Brian.
piece
That's
needs
exactly
to go
it.
away.
Okay, I will take a look at that. And based on this conversation, I think we have a couple of things to propose to the changes. So any other feedback you have on the spreadsheet would be fantastic.
Did you have anything else, Michelle?
No, thank you.
Do we have any other members of the public who would like to comment.
Yeah, this is Judy Fox from Q Pharma.
Go ahead.
I have, you had mentioned about the value being assigned at the WAC price at the time of the report. And I'd like you to consider the WAC price at the end of the year, because that pricing can change throughout the year for various reasons. So because it was for the previous calendar year, if we can just use the WAC price at the end of the year, I think it would simplify reporting and not compromise the integrity of what you're looking for.
Appreciate that. That is a good thought. Certainly, that was something that was in the written comments the written thoughts that I put around in drafting was referring in the sort of new definition, referring to the current WAC price, that being defined as the WAC price at the time of the report was given. Since my concern initially in drafting that is that since we're doing these reports on an annual basis in April, that we don't want you to be having to go back and look at what was the WAC price on each particular day that a sample was delivered. That seems administratively impossible. So like having it being a specific time, my sort of initial assumption would have been that the easy way to do that would have been say, what's the WAC price now that you are delivering the report or that you are filing the report with us? But I can see an argument for using the end of year date. And that would be consistent that even if there was a price increase for the coming year, then because the sample was delivered in the previous calendar year, it would be more accurate to use the WAC price for that period.
Yeah, I think the industry people might have a different point of view, but as a vendor who provides assistance in compiling these reports for clients, we're working on Nevada right now, and that's due March 1st. So if we have to wait until the day we file the report to look for the WAC for 30 some clients, it just becomes, an administrative burden, I think. But, industry might have a different opinion, but that's from the vendor side, I guess you would say, is that question. Yeah.
I appreciate that, and we'll take that into consideration in modifying that definition.
And then I have one other item with assigning a value to the samples. I did reach out back in October to the FDA. I don't know if you saw my email. I had forwarded you their response. They actually supported the idea of assigning a value, but not a price. And they were very clear that they were two different things. So I can forward that on to your team after the call, Numi, again, of what the FDA's response to that was. But they actually said there wasn't a conflict and that they supported the idea of samples having a value and not a price. So I can send that to you.
Yeah, no, I would appreciate that.
Yeah, absolutely.
I apologize if you had sent it already.
Oh, no, I'm sure you get more than one email a day. No problem.
Yes.
And Numi, will you share that more broadly, please, so we can all benefit from that communication that you're receiving?
If I can find it, or if Judy sends that along, I will send that around to the group.
I will forward it to you right now.
Great. Thanks.
Thank you. And your time frame on responses so that we can have some time before the next meeting to cull through things?
So I had put in my original email, I had a target of 2 weeks. So that's February 1st is 2 weeks from today is when I'm looking to get written feedback back. Part of the reason for that is we have legislative session this February. So my ability to pay attention to making more changes to these rules may be somewhat limited. So my hope is to have enough time to actually do that work while also giving you enough time to formulate thoughts and comments and go back and forth with your folks, legal and otherwise, to make sure that you can get that back. So that's what I'm looking at right now is February 1st. I mean, obviously if stuff trickles in later in that week, it's probably okay, but that's sort of my target.
And what's your target for turning it back around?
Let's say end of February, since Karen, do you remember what the placeholder date is for March?
It is March 1st.
March 1st. Okay, so I will try and get a draft in. I say this every time that I will try and get a draft a week ahead, but this legislative session, I make no guarantee. I will try and get it back to you a week ahead of first. That is what I will try to do. So
That'd be
I can
great.
be
since it's the last-
understanding about. Yeah, go ahead.
Yeah. That'd be appreciated since it's the last, effectively the last meeting. So it'd be great to have more than, a few hours to share our thoughts with you.
No, absolutely. I mean, it is not my preference to drop, an entire new draft on you the morning of the meeting. My hope is to get ahead of the ball on this one, but no promises. Okay, I am still on public comment. Did we have any additional members of the public who would like to give comment?
I wanted to just make a quick clarification. I think maybe
Yeah, Brian.
I want to make sure that it wasn't misinterpreted on Nevada, just real quick on that, that I think Judy may have been talking about something different. Nevada doesn't require the WAC on a sample. I'm not aware of anyone requiring that.
No, I was saying that just comparing that we are compiling reports now that are due to Nevada March 1st, and to
Right.
compile a new report for Oregon that would require the WAC, we'd be having to look back to 30 clients at the time of the report to find out what that WAC is at that time, rather than collecting it December 31st, sending out a note saying, everybody send me the WAC price on these NDCs.
Right.
That's what I meant. I didn't mean Nevada had to be reported WAC price.
I just want to make sure there was not a misunderstanding that it's required in other states, because it's not.
No, it's not. No, I mean, it is, but it's under completely separate laws than the disclosure laws.
All right. Anything additional from any members of the public? Okay. Any additional thoughts from any of our RAC members? Okay, so I'm gonna kind of go through next steps, which we've already bled into a little bit, is that I'm looking for feedback back on the current drafts 2 weeks from today, which is February 1. And I will try and get a draft back to you all at least a week ahead of the last meeting that we have scheduled, which will be the last meeting. So I don't really have window to get the rules filed later than that, and through our process. Next meeting tentatively scheduled for March 1st. That's when we'll expect to have it. We'll have materials, invitation, agenda, etc. around at some point before then. Let's see, what else? I have requested feedback on a couple of specific things in the email that was sent around this morning. Feedback on the definition for monetary value, feedback on the sort of potential definition for gift if we put that in, as well as other compensation if anybody has thoughts on that. The other things that we will be addressing at the last meeting are the diversity, equity, inclusion impact statement, as well as the impact on small businesses. If anybody can think of potential impacts of implementing the rules on diversity, equity, inclusion, or on small businesses, as I said in the email, we don't really have a clear picture of what the industry looks like as to whether sales reps are predominantly employed directly by companies or are maybe operating as independent contractors.
Is it defined small business?
I think it's 50 employees or less. Is that right, Karen? Or Rick?
50 or fewer employees. And I think the business has got to be, is that a single business, right? It's not like a subsidiary thing. I think it's the entire business, if I recall.
Yeah. So if there is a thought that there are a significant number of pharmaceutical sales reps who operate as businesses that would fall within that definition of small business. Would appreciate feedback on that.
Definitely are some. Yeah.
Thank you. And also, I'll look forward to seeing any thoughts on the monetary value issue as it relates to the FDA statute, Affordable Care Act, et cetera. And I'll look forward to hearing anything on the Sunshine Act as well as other thoughts. So that's kind of where we're at. Any thoughts, questions about next steps, or are we clear on where we're going next? Okay. Well, somehow I have managed to get us through the agenda 15 minutes early, which is, I think, a first for this group. So good to see you all again. I look forward to seeing your comments. I look forward to getting you a draft at least a week ahead of our next meeting, and to see you all on March 1st. Thanks, everybody. Aaron,
Thanks.
you can stop this.
Thanks.
Thank you.